afternoon. I'm Charles Lejano. This is One News Now. The Health Department says Manila-based facelift may be commendable, but onlookers must still adhere to strict health protocols. The DOH also reminds the public to take it upon themselves to observe minimum health standards in public places. JC Cosico has the report.
The Health Department has expressed alarm after people flocked to Ross Boulevard over the weekend to take a look at Manila-based artificial white sand. Photos and videos online show that health measures such as physical distancing were not observed.
Ito po ay isang nakakabahalang sitwasyon. No? Alam po natin lahat na hindi pa po nawawala ang virus dito sa atin. Kung meron ay mga proyektong ganito, ito po ay maganda at kahanga-hanga. Ngunit kailangan pa rin po natin i-enforce ang minimum health standards.
Vergere noted, however, that the Manila City government and the Interior Department were quick to respond on the matter. The health official also confirmed that the Interior Department has launched an investigation against a group of medical practitioners. Last week, the concerned doctors and citizens of the Philippines held a Flatten the Fear campaign in Pasig City. Some attendees were seen not wearing face masks, saying they have already undergone COVID-19 prophylaxis. In the same event, they also called on the government to lift the imposed lockdowns.
Sa ngayon, kung ano po ang pwede nating, kung ano ang lumabas doon sa findings nila, necessary sanctions will be meted out. Unang-una po, alam po natin bawal yun. Ano? Wala pa po tayong pinapayagan na mass gatherings.
Meanwhile, the DOH has submitted to Malacanang its recommendation to issue an executive order that will regulate the cost of COVID-19 swab testing.
Napansin na nga po natin itong mga iba't iba, no? Differential pricing across the different laboratories in the country. And nakikita nga rin po natin yung malaking difference.
Some lawmakers earlier called on the government to have uniform swab test costs amid its varying prices.
Gusto lang ho namin sabihin, bakit ba executive order ang hinihingi natin? Kasi ngayon, meron ho tayong batas. Ito pong batas na ito, nakasaad po dyan yung price ceiling for medicines. Pero hindi po nakasama kasi yung for diagnostics and even professional fees.
The agency also cautioned against the use of ultraviolet light for disinfection purposes. Vergere explained that there is no sufficient evidence yet that it can eradicate SARS-CoV-2. It can be recalled that a demonstration of a UV light robot in Baguio City left a number of people with eye irritation.
Katulad ng sabi ko nung isang linggo, ito ay maaaring maka-apekto sa ating mga mata and it can even dun po sa severe na exposure, maaaring masira yung cornea ng mata ng isang tao. Pangalawa, maaaring makasunog din ang balat, no? Pangatlo, meron din ho siyang effect sa respiratory system.
The DOH advised the public to use it in a proper manner, with guidance from experts. For News 5, JC Cosico, we are One News.
Cases in the country continue to rise, with nearly 3,500 new infections today. The latest figure brings the case tally to over 290,000, some 55,000 of which are considered active. The virus has killed 15 people in the past 24 hours, raising the death toll to almost 5,000. Some good news, though. More than 230,000 Filipinos have gotten better from the disease, with 400 new recoveries today. Senators are flagging the lack of state universities and colleges, or SUCs, offering medicine courses in the country. This has spread health crisis calls for medical practitioners and researchers. To give us details, Mean Los joins us live from Pasig City. Mean, what were some of the concerns raised by senators regarding schools and medical programs?
Yes, Charles. In today's Senate budget hearing, senators asked the Commission on Higher Education about the lack of schools offering medicine courses. There are around 10 regions in the country which do not have state universities and colleges which offer the said program. Just last week, the Senate passed on third and final reading the Medical Scholarship Bill. However, the budget for the measure was not yet included in the 2021 General Appropriations Act. Senator Joel Villanueva asked Jed of the steps they are taking to address the concern, even with the absence of the law. Some regions that do not have SUCs offering medicine courses are Central Luzon, Calabarzon, Central Visayas, and Northern Mindanao. CHED Chairman Prospero de Vera admitted to some setbacks in setting up medical programs for SUCs. These include the requirement of pre-med courses. He also mentioned the one university, one training hospital policy. De Vera said a lot of government hospitals across the country have become a shared training ground for both private and public universities. He also noted that some regions like Caraga do not have level 3 public hospitals, which is a prerequisite for them to be utilized for medical training. The good news, though, Charles, is that SUCs in some regions are now applying to offer medicine courses. Meanwhile, the University of the Philippines administration is doing a feasibility study on building a UP Philippine General Hospital in Diliman. Though this is still not included in their budget request for 2021, UP President Danilo Concepcion said they will need 9 billion pesos for the first phase of its construction. Charles, Concepcion said the planned UPPGH in Diliman will have a 700-bed capacity. It will also come with the College of Medicine and Cancer Research Center. Charles?
Right, man. Thanks for that. You mentioned that there are 3 SUCs that are proposing to offer medicine courses. Could you tell us what these schools are and what exactly do they need to jumpstart their said programs?
Charles, these schools are actually located in the regions which currently do not have SUCs which offer medicine courses. These universities or SUCs are Western Mindanao University, Cebu Normal University, and University of Southeastern Philippines and Davao del Sur. Chairman Prospero de Vera of CHED said they will be needing at least 1.3 billion pesos to start the program, and the Senate is actually considering to include this budget to make sure these SUCs will be able to kick off with their medicine courses as soon as possible. Charles.
Right, Mayor. And how did the senators react to the planned UPPGH Diliman? Did they agree that they should be located in Quezon City, or did they have something else in mind?
Actually, Charles, the senators do not have an issue with the construction of a second UPPGH building, but some of them, or several senators, including Senator Villar, Angara, and Villanueva, are actually suggesting that it should not be constructed in Quezon City because there are a lot of hospitals already present in Quezon City. They want the UPPGH, the second UPPGH, to be constructed in UP Los Baños in Region 4A, where there is still no public hospital with an SUC that is offering a medicine course. Charles?
All right, thanks for that. That was Mean Los Baños reporting live from Pasig City.
Thank you.
President Duterte has allowed some 1,500 Filipino nurses and other medical professionals to leave and work overseas. In his briefing this afternoon, Palace spokesperson Harry Roque said only those with complete documents as of August 31 will be allowed to leave. The Philippine Overseas Employment Administration earlier urged the president to extend the exemption from the deployment ban for healthcare workers. The POEA had temporarily suspended the deployment of health professionals abroad so they can help fight COVID-19 in the country. Roque said President Duterte will discuss the matter during his address to the nation tonight.
Wala pa pong desisyon sa total lifting, pinagbigyan lang po yung nagkakasos na para sa mga papeles. So wala na po pwedeng reklamo na nagkaroon sila ng gastos tapos hindi sila na
More stories after the short break. Keep it here. The PNP Highway Patrol Group has intensified the enforcement of physical distancing in public transportation. following the IATF's back and forth on the policy. Earlier today, authorities inspected passengers' compliance with a 1-meter distancing rule. Commuters are not allowed to be seated facing one another, and the Interagency Task Force has set a 5,000 peso fine for physical distancing violators. Over the weekend, President Duterte rejected plans to ease physical distancing measures in public transportation. The House of Representatives is currently deliberating rumors of a brewing attempt to oust Speaker Alan Peter Cayetano. To give us details, Marian Enriquez reports to us live from Manila. Marian, what is the latest on this most recent power struggle of the House?
Charles, a lawmaker assures that there will be no coup that will happen in the lower chamber. Committee on Appropriations Chair Eric Yap clarified that Deputy Speaker Paulo Duterte never said he would overthrow House Speaker Alan Peter Cayetano. Yap also noted that both parties have sorted things out. Over the weekend, the presidential son said he was disappointed over the fate of their respective allocations under the leadership of Cayetano. Duterte also reportedly sent a text message to his colleagues to declare the House Speaker post vacant, suggesting a coup d'etat. But he later on clarified that he does not want to get involved with the budget, noting that he will leave it to his colleagues if a change in leadership will push through. Duterte also explained that anything he says may be construed as a statement of his father, so he would rather suffer or work in silence. This issue stemmed from the badgering of Negros Oriental 3rd District Representative Arnolfo Arnie Teves Jr. on the distribution of funds to congressional districts under the Public Works Department next year. Teves earlier said there were rumors that the gig city will get an 8 billion peso share, while the entire province of Camarines Sur will receive 11.8 billion pesos. But Camsur Representative El Rey Villaferte insisted that Teves' claims were mere hearsay. He explained that Camsur has 5 districts, so if the amount will be divided, that will be less than 2 billion pesos. He also said that there are national flagship projects in their province, that is why their allocation may be bigger. But former Negros Occidental Representative Albi Benitez said in a statement that Villaferte's actuations are totally baseless and a figment of his overactive and defensive imagination. He added that Villaferte should put his money where his mouth is. He challenged him to explain the 420 million construction of their provincial capital that will be shouldered by the national government and be transparent with his district's budget. Charles, both Congressman Yap and Villaferte said that majority of lawmakers support Cayetano to retain it as the Speaker of the House. They also noted that they will heed to President Duterte's preference should he push through with the term sharing bill. Charles?
Thank you, Marian Enriquez, reporting live from the city of Manila. And there's no stopping human rights groups from staging protests on the 48th anniversary of the Declaration of Martial Law. Laila Pangilinan shares their messages to the public in this report.
Various human rights groups trooped to the Commission on Human Rights and the Bantayog na mga bayani in Quezon City to stage protests on the 48th anniversary of the Declaration of Martial Law. Bayan Muna Chairman Nery Colmenares, who was imprisoned under the dictatorship of Ferdinand Marcos, said he fears another despotic rule, this time with President Duterte as mastermind.
Si Marcos ay nangako na kaya siya nag-martial law para sa pagbabago, para tanggalin ang korupsyon, ang krimen, at ipamigay ang lupa sa mga magsasaka at trabaho para sa manggagawa. Ganun din ang ginawa ni Duterte.
Lawyer and former senatorial candidate Erin Tañada also pointed out the supposed similarities between the leadership styles of Marcos and Duterte.
Yung ginamit ni dating Pangulong Marcos, yung takot, fear, no? At yun yung ginagawa rin ng kasalukuyang administrasyon. Tinatakot niya yung mga mamamayan sa pamamagitan sa laban sa droga para hindi makita yung mga problemang hinaharap ng pangkaraniwang mamamayan. Yung usapin tungkol sa kahirapan na hanggang ngayon lalong lumalala sa panahon ng pandemya.
Staunch Marcos critic and human rights lawyer Chel Jokno meanwhile reminded the Filipinos to never forget the atrocities done during the martial law.
Diyan sa record natin yan eh. Nasa mga desisyon ng Korte Suprema, nandito sa bantayog ng mga bayani, at marami pang mga ebidensya kung paano nilabag ng mga Marcos ang mga karapatang pantao kung paano nila ninakaw ang pera ng bayan. Kaya huwag tayong madadala dun sa mga sinasabi nilang napakaganda daw ng martial law ng panahon na yun.
Kabataan Party List Representative Sara Ilago echoed this.
Ang saysay ng kasaysayan ay para hindi na maulit muli ang mga nangyaring abuso noon, magpasa hanggang ngayon, at para sa susunod na mga henerasyon ng mga Pilipino.
The groups also called on the Duterte administration to stop the killings, especially among the urban poor. They proceeded to the UP Diliman to continue their protests. For News 5, Laila Pangilinan, we are One News.
For more updates, follow News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for in-depth analysis. And you can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. We are One News.